Okay, hello everyone. This is Michael with Dr. Dzugan here. Thank you for taking the time to speak with us again, Dr. Dzugan.
Hello, Michael, and thank you for the invitation to be with you today.
Anytime we get to hear from you, the expert, is such a valuable time and information for all of us. Here are a few questions we are getting from our members. Specifically, which supplements do you suggest we should be taking at this time to boost our immune system in order to protect us from COVID-19?
As you know, there is very long list of supplements that have pretty good backup with different studies and publications, and anybody can find in different medical libraries like PubMed online. So I will name just few of them that we use most frequently for our clients. Some of them stronger, some of them less stronger, some of them have very long list of studies and support, and some of them have just folk information. We know this from just our parents, our history. So we try to use some supplement that normally show some good results during flu season, especially because we are talking about flu season. So the major agents that normally can work pretty well if we talk about our current clients, of course, different kind of prescription hormones and not prescription hormones like pregnenolone, DHA, 7-keto DHA, and a few others. Different supplements such as thymic protein can help a lot with immune system because it has direct effect on lymphocytes. 3-beta-glucan, this is supplement that can increase production of macrophages. Macrophages is important. Macrophage is important big cell that can fight with infection. Zinc, vitamin D3, serapeptase, echinacea, of course, vitamin C. Melatonin has a lot of studies that show pretty good enhancement of immune system, even for patients who have like cancer. Melatonin is extremely powerful supplement. Vitamin E, selenium, grape seeds extract, also green tea extract, B complex, magnesium, ginseng, cat's claw. Like I said, there is a pretty long list of supplements.
Thank you, Dr. Dzugan. Of the products you mentioned, generally, what is the proper dosing and time of day that you suggest?
Of course, age, height, weight, sex, extremely important when you try to choose dosages of supplements, and it's always better to use some help from a health advisor. But you can use moderate dosages of some supplement that normally have very minimal possible undesirable problems when you take. So, for example, when you take vitamin C, it's better to take a dose during flu season, at least 1,000 milligram. If you will have diarrhea, because vitamin C, you need decreased dose in half, and just titrate dose and take dose that will not give to you any problem. Thymic protein, usually we suggested 1 pack, and 3-beta-glucan, we suggested 1 capsule. If you have people around of you who already have contact with coronavirus or any kind of flu, other flu conditions, you can you can double dose of these two supplements because they're very powerful. Zinc can be taken from 10 to 25 milligram daily, so you will not upset your stomach. Vitamin D3 can be taken approximately 1,000 international units. Vitamin E, 400 international units. Melatonin, 3 milligram at least before bedtime. Echinacea can be taken 1,000 milligrams. Serapeptase, 10, 20 milligram. Again, I can go and give you information about dosages, but it's like I said, it is always advisable to talk with some people who can give you some good recommendation, rather because list is long and you don't know what should be taken in your specific case. But like I said, it is very important to apply any kind of supporting program based on your age, on your sex, on your weight, height, also medical history, and especially if you have any prescription drugs, you need to know this information. This way, you will prevent any possible interference between drugs and some supplements, because the rule is do no harm, nobody cancel.
Yeah. Now, Dr. Dzugan, can I suggest these products to my family and friends if they're currently not on a personalized DZ Logic program?
Of course you can. And like in case when you said, if you're on program, so you can use some knowledge that you already gained during almost 15 years being on program. So you know how supplements work, you know what normally suggested for you to do when you call us and ask, okay, we have some flu season now, can I make immune system stronger? So you know what kind of trick we can do, and you always can give at least some supplements to your family members, supplements like vitamin C, vitamin E, like echinacea, like zinc, vitamin D3. So it's supplement that will not give you major problem or any problems.
Dr. Dzugan, do you think us as Americans are currently taking enough necessary steps to stop the spread of COVID-19?
Nobody knows for sure for right now. I think this question to officials, government at all levels, federal, states, local, they should unify their efforts. And I don't think we had clear idea for right now what we can expect in the nearest future. My opinion is quarantine is the best way to prevent a spread of this infection. Why? Because unfortunately, most people, they will not follow government recommendation. Many of them have poor discipline and do not take this infection seriously. And if we will just do some limitations in some states, like right now in New York or California or state Washington, and we'll leave other states without such restriction, infection will spread. So it's no matter what we'll do. But at least if you talk about ourselves, help to our immune system is in our power. And this is exactly what we can work with right now. And I can tell you that we never will be, we'll live in the same world anymore after this infection, because there is a lot of scary information. You know, I thought a lot about all this situation, and I can give to you interesting interesting case that turned around my brain. In 1989, my mother-in-law in 1-2 days became deadly sick. So I took to the hospital, to my hospital, and I got professor of oncology and pulmonology, and they told me that it's absolutely aggressive, crazy cancer of the right lung. So she will not live more than 5-7 days because it's so fast. So I didn't understand why it happened, because she works in the hospital, and annually they had fluoroscopy. So every year they check lung system. So she had no any problem, and suddenly in 1-2 days she started to cough. She started to have pain in the chest and a high temperature. And when we did X-ray, we didn't see just lung. It was absolutely dark picture. So professor of oncology and pulmonology told me that there is nothing we can do, and be ready. So my wife was upset, and I decided to do something. So what we did, we start to do detoxification. Then we use albumin, globulins, different supplements that improve immune system. So what happened next? She died, of course, but she died in 2007 from absolutely different, from aging, and she had severe stroke, and she died from stroke. But she lived after this crazy diagnosis for 18 years. And why I said this, because it's made my mind, changed my mind. And I start to think absolutely differently on all these, anecdotal cases. That's why, again, I think that sometimes doctors make mistakes. Sometimes we underestimate the power of our body ability, and immune system is very, very powerful instrument, and we need to respect how our body can work in different conditions.
Well, Dr. Dzugan, thank you for taking the time to check in with us again today. We always greatly value your time and opinion. Everyone, please feel free to reach out to us at any time where we can help you get the products that Dr. Dzugan spoke of today. You can email us, visit our website, or call your member care representative directly. All the ways to contact us are also at the end of this video or on our newsletter. Stay safe, everyone. Healthy, everyone, and we'll be back again soon as we closely monitor this COVID-19 pandemic. And Dr. Dzugan, thank you again for your time. We really appreciate it. Have a great day.
Thank you, Michael.